It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, which of course features some of the best doctors in the Dallas-Fort Worth area helping change people's lives. And of course, look at this, Candace. The new set,
I
Best
love
Docs
it.
Network. Yes.
Our new home.
New set. It looks outstanding, and so outstanding, we're going to kick off the show with a spine specialist.
We sure are. It's Dr. Robert Myles, and he can tell you how he can take care of your back pain.
Low back pain occurs in about 90% of the population over their lifetime. Of those 90% of people that have back pain, about 70 or 80% of them will have a second episode of back pain. Back pain accounts for the second most common reason for missing work or school behind the common cold. Back pain can be just a simple sprain, and it can be something as bad as a disc herniation or severe degenerative changes in the lumbar spine. The majority of those back issues are related to some type of degeneration of the back in some way. In this model here, I have an example of what I would say is the degenerative cascade. If you look at the very top disc space, which is right here, if you notice it's nice and plump and it's very high, this is a healthy disc. As the disc starts to go through a wear and tear process, you can kind of see that the disc space slightly collapses here, and you can see some changes which look like some kind of reddish changes in there. That's an inflammatory process that's occurring. Over time, if you notice, you keep coming down, you still see that the disc space gets smaller and smaller, but you start to see the formation of these little, what we would call bone spurs or osteophytes. These osteophytes are little edges of the bone that are reacting to the change in the disc space. If you look down here, you notice that the disc space is almost completely collapsed here, and the osteophytes on the side here are almost touching each other. These can be sites of bone pain. If you look here, you can see that there's nice space here for the nerve to come out, but if you look at this the one next to the bottom, you can see that it's pinched, and there's not very much room for the nerve to come out. This can cause back pain and leg pain. Generally, when you have back pain, you don't need to go to the operating room. 90% of the people that have back pain don't need a surgery. Generally, what you do if the pain is very severe or is long-lasting, you show up to a physician's office. What we do at that time is do a history and physical to try and determine what's the cause of your back pain. And we want you to get back to your life, your work, enjoying your family, your hobbies, and your friends. That's the goal of life, and that's where we want you to be when we're done.
Vicki had sinus pressure with pain every day until she met Dr. Joshua James. To find out more about Vicki's story and other life-changing stories, log on to bestdocsnetwork.com.
Asthma is an inflammatory disease of the lung. It affects the bronchi mainly. They develop inflammation that causes the bronchi to develop muscular spasms, and that gives the person a sensation of tightness.
I was able to play with my friends, but when I was running on the playground, it felt the same as it did in gymnastics.
Many times asthmatics cough a lot more than they wheeze, and because they don't wheeze, people don't think that they have asthma, and they don't get checked out for asthma.
I tried not to pay attention to it because I didn't want it to interfere with my gymnastics and what I was doing.
She was saying she was tired all the time, she was falling asleep, she didn't want to go play, and she didn't want to do really anything.
In someone like Abigail, who's a child, they don't even realize that that's not normal. She thought she felt like everybody else did. And they don't report it to their parents or their doctor or anyone. We were just very lucky that we found that out. and she said, wow, I feel so different. I feel completely relieved, and I feel much more energetic, and I feel like I can breathe. And her mother and I were just stunned because we really had no idea this was even going on in this child.
My life is so much better, and when I run at the gym and on the playground, I just feel like I'm a different kid.
It's wonderful. When she's talking to the kids, she said, I want other kids to know that there is something like this, and that maybe if they have it, they can have a different life too.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
All of our doctors here at the Best Docs Network are all about changing people's lives. Like our next physician, it's Dr. Rebecca Stachniak, who's going to talk about a brain tumor removal.
I woke up on a Sunday morning and I had this awful pain. And it was like I was hurting everywhere. But I knew it was like my head and my balance. I couldn't get my balance. So I told my wife, I don't feel good. I think you need to take me to the hospital. Went in and a surgeon on duty examined me, and they gave me CAT scans, and when she told me that she saw a mass in my head that weren't supposed to be there, and she couldn't tell me exactly what it was, but she wanted me to see a neurologist.
He was having some problems with not only headaches, but not being himself too. Ultimately, he got seen by a neurologist who did an MRI, who discovered the very large tumor, and he was placed on seizure medications and referred to me for resection of his tumor.
Yeah, you got a big one there. She said, but we can handle this, you're gonna be okay. And she started drawing. She drew my skull, and she drew where the tumor was, and she just went to work, and she drew that entire table with pictures of how she was gonna go in and cut it and get it out.
It was very unusual for us to find one that large and that had been that locally destructive of so much of his tissue that it ended up requiring so much more in terms of reconstruction. Because it was not only just the resection of the tumor that was so important in him, but we needed to give him back normal contours so that he looked normal in public after the surgery.
Knowing that she was confident and she knew what she was doing, and everything she told me, that's the way it came out.
And he's been doing very well for many years now. We've never seen any signs of any residual tumor. He sees us about once a year and is doing very well and enjoying a very active lifestyle and enjoying his retirement.
I'm blessed. And every day we wake up, I think about her. She did it, you know. That is, that's my way of telling it. Here we are 7.5 years later, you know. That's my best buddy.
Hypertension, this is a bad disease. It causes two main problems, strokes and heart attacks. Neither of those are good. What are the magic numbers in hypertension? Well, 120/80 is normal. At 140/90 and above, we call hypertension. When you're at 160/110, that's when we get upset and need to become aggressive with our treatment. When you get to be 180/120, that's when we really get upset, and that's the time to go to the emergency room for urgent or emergent treatment. What can you do to prevent hypertension or to treat it once you get it? Well, weight loss is the most important thing because being heavy is one of the biggest risk factors for becoming hypertensive. Also, lowering the salt in your diet is a good idea. You can use the DASH diet, D-A-S-H. You can find that on the internet anywhere. Getting adequate sleep and adequate exercise will reduce your blood pressure also. They say that emotional tension causes hypertension, and that is true. So relax and enjoy your life, lose weight and exercise, and your blood pressure will come down.
For a little over 10 years after I had a severe case of shingles, it was in my face and in my scalp, I was still having a lot of pain.
Shingles pain or post-herpetic neuralgia is a very painful condition. Humans are exposed to the chickenpox virus at an early stage in life. Sometimes the virus stays dormant in the nervous system and reactivates itself at a later stage. When that happens, people end up with shingles.
Sometimes, if it's severe enough, I have injections. It's been the best experience because he gives me the medication that takes the edge off, and hopefully, at some point in time, he says it's possible that the pain will go away.
Shingles pain or post-herpetic neuralgia is a very tough disease to treat, but it does not preclude us from helping patients to achieve pain freedom and control their pain as much as we can.
From just meeting him first time, it did not bother me at all. It never bothers me when I come in for an injection.
And I've been seeing her right now for almost a decade. Her pain has been maintained on the medication. On and off, on average, maybe once a year or so, her pain will flare up and we'll go back and repeat the nerve block on Sandra, and she'll get better for a while. And so far, she's been doing okay.
He's really somebody who is easy to listen to. He's easy to let him administer the pain medication, do the injections, whatever's necessary there.
It's very important to be compassionate, listen to the patient, see the problem they have, and try to control their pain as much as possible. Nerve pain generally is very difficult to treat, and this condition can linger for months or years before it gets better. The disease will get better over time, but takes a long, long time before it goes away.
I feel very confident that Dr. Farhat is working to help me have pain freedom.
Denise's passion is tending to her show dogs, but had trouble doing that due to chronic pain in her hands until she met Dr. Traum. To find out more about Denise's story and other life-changing stories, log on to bestdocsnetwork.com.
I got up in the morning, and all of a sudden, as I stood up, I thought, something ain't right, you know. And so I guess pretty quick I had a horrible pain in my back. I kind of, you know, messed around thinking that I would get over it, you know, that it would go away, and it just got worse.
A back fracture is a very important injury. It can be very debilitating to people, and especially in the osteoporotic crowd, the over 65 or around that age crowd, where they're already prone to having very soft bones anyway.
It just really took all the fun out of life, you know, because I was hurting so bad.
One of the things we can do now is we can actually go in and stabilize those fractures using cement. And it's a very well-known procedure that has had a lot of different modifications through time. Now we do it's called a balloon kyphoplasty. So we actually put a balloon into the bone and blow the balloon up to create a cavity where the cement will travel when we enter it into the bone, which makes it a safer procedure to make sure the cement stays where it should go and doesn't go where it shouldn't go. When you do that, you're basically doing what a cast would on a fracture on an arm. You're immobilizing it. And what hurts from a compression fracture is movement. So whenever the little lady or little gentleman is rolling over in bed or getting up to stand, they're going to have extreme pain. And so they choose not to do those things, and they lie around. And when they lie around too long, things happen like blood clots in their legs form. And so there's a lot of things that happen when people are immobile. And so the goal of our practice is to get people active again.
The new procedure that he does is a wonderful thing. I would lie down on my stomach and then he would work on my back.
Even though it's a surgical procedure, they literally feel better when you're done with the procedure than they did when you start the procedure. I mean, we're talking about 60s, 70s, 80s, 90-year-old people that feel better and they get up and leave. They walk out and they're home and they're feeling better.
Dr. Stevens was just great with me. I feel wonderful now. I just feel wonderful.
As always, for more information on any of the amazing doctors you've seen on today's show, just log on to our website, bestdocsnetwork.com.
All right, time to move on to our next best doctor. He's one of the best prosthodontists in the Dallas-Fort Worth area, and he helped put one lady's smile back on her face. Time to meet Dr. David McFadden.
I had started very early in my 20s to get a lot of dental work, crowns, and then in my 30s I realized it wasn't going to last forever, and this created some problems. Not only is it expensive, but it takes your time and it's uncomfortable.
Implant treatment has really been a great technology for patients whose teeth have reached a point where they can't be restored. Teeth that reach that point either have broken off, have decayed, or are just so broken down that we can't use them anymore in the reconstruction process. In those patients who have reached that point, we recommend removal of the teeth and reconstruction with dental implants. Sue had been plagued by a lifetime of dental problems, including decay and tooth loss. She had reached a point where we did not feel comfortable saving any of her natural teeth, so we decided we'd do a reconstruction for her with dental implants.
My friend Kelly is in the dental educational field, so he's very meticulous and precise. So you always go to the person that's best suited to the job. And in this case, it was a prosthodontist. Kelly said this was the only place to do it, and so this is where we did it. And he was right.
Sue was referred by a very close friend of hers who is a dentist here in Dallas. I was honored to get that referral because they had researched her needs and visited many offices before deciding to come here. What they found in their search was that a lot of the other practices were heavy on sales and very light on education. What they liked about my approach was that I simply gave them their options and was able to show them similar cases so they could make their own decision.
Dr. McFadden is very easy to talk to. He can take a joke, he's got a sense of humor, he's serious when he needs to be. He's very thorough, both in the procedures and also letting you know what's going to happen and how he's doing it.
Many times, patients' dental situations have deteriorated to the point where their whole mouth needs to be treated. Many people can't afford that, so we try to stage their treatment in a way that we have good stopping points along the way so they can regroup and plan for the future.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
We treat a lot of various diseases that have chronic pain, and musculoskeletal pain is one of the big categories. Within the category of musculoskeletal pain, you have people that have fibromyalgia, lots of other directly related skeletal problems, and one of the more controversial diseases that you have is chronic Lyme disease.
I had been experiencing pain from my head to my toes, and I had been to numerous doctors, and I knew there had to be something different, something better, because I knew I couldn't live this way and I did not know what the pain was. I found Dr. Shaw in 2002. During our first visit, he asked me where my pain was, and I said, there is not a place in my body that I do not hurt. And he said, well, fibromyalgia, you don't hurt from head to toe. He said, have you ever been tested for Lyme disease?
Gloria had several problems. She had the myofascial pain, she had joint pain, and still does. She had what we call neuromatous. She'd had some nerves operated on because of pain. She has severe headaches, and some of her headaches are vascular, some of her migraine.
I get to visit my family that live in Oklahoma. I can make an occasional car trip. I can do things that I didn't think I was ever going to be able to do again. He listens to every ache and pain you have, and because of the medications in his treatment plan, we have got to where I am today.
Several years after we started treating Gloria, one day she came in all smiles, And she said, for the last 2 weeks, I've not hurt at all. In someone that's had chronic pain for years, it's an incredible miracle.
During my visits with Dr. Shaw, one of the things that we have discussed is not only mentally, but physically, to achieve pain freedom. And each visit, I feel like we are getting closer and closer to that objective.
Mental health is just as important as physical health, not just in adults, but in children. In our next story, Lifeworks Group helps children with their mental health.
I have a 4-year-old daughter who me and her mom went through a divorce, going on 3 years next month. And I saw some behaviors on my daughter that I didn't see normal. She didn't socialize with kids. We will go to the park, we will go to McDonald's, and she will play in the playground, but then when kids will come, she will say, let's go, you know, or quit playing, just standing there besides me and then say, let's go.
She was having a really hard time in social settings, interacting with anybody besides her dad. She was very shy with even children her age. Any other adults would have a really hard time communicating with them, talking with them, playing with them. And so he was concerned that she was starting to be really withdrawn, and he didn't want that for her.
At first it was like, should I do this or should I not? Once I interviewed with Katie, you know, I kind of felt comfortable that this was the right decision.
What children do is they come in and we have a whole playroom stocked full of toys that have been researched and picked specifically for their therapeutic value. Children come in and they use toys as their words. And so based on the toys that they choose and how they interact with them, how they interact with me as the therapist, really gives me a clue into what they're struggling with at home, at school, and gives me a great idea about how to help them through that.
I had doubts of bringing my daughter, thinking that she was too young. You know, I even asked her a couple of times, are you sure that her age, is she okay? She said, you know what, it's the sooner the better. You'll be surprised how many parents wait until kids are 11, 12, you know, and it's tough on them.
In the first several sessions, she wanted Dad right next to her and really close with her. As we've moved on, her self-confidence and her ego strength really has just been incredible. She's gained a lot of strength through this process.
You know, it's a great feeling. Seeing her progress and seeing that she has built confidence in her, it feels really, really good. It's a great satisfaction.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
They were trying to get my veins, if I'm dehydrated and if I was colder, that my veins just don't want to pop up. And so they would put the compresses on, put me under warm blankets, and sometimes it'd be, 30, 45 minutes to an hour, so I would be that much more anxious to see if that was going to work before, they were able to, actually get an IV.
When you're not able to get their vein or, stick them the first time, they don't quite understand why that's the case. There are certain things that do prevent us from being able to thread our catheter through their vein. Here at SDC, we have just received a product that is accessible to our PAMA physicians called the Vein Viewer. It's an amazing product.
Often the patient's number one anxiety coming into a surgical procedure is the starting of an IV. As an anesthesiologist, my role is to facilitate the perioperative process and make it as efficient as possible. And having a device like the Vein Viewer is helpful for patients who have veins that are difficult to find.
We can use it on all of the patients to be able to visualize a live view of a patient's vein.
And using this tool, it allows us to get the IV started potentially a lot faster than if we don't have it. And that ends up speeding up the whole perioperative process.
We are the first facility in the entire country to have this product. We're very, very happy that we have it. It makes my life as a nurse way easier being a pre-op nurse and starting IVs every day and drawing blood on patients.
As a PAMA physician, I have the confidence in knowing that we have the best equipment possible to start IVs even on the most difficult patients. It makes me feel more confident going into the operating room that we're going to have a good IV.
You know immediately, okay, this is the right one, or no, this is not the right one. And so it really prevents multiple sticks, especially for patients who truly do not have great veins.
I know that I can come in and be relaxed and not be anxious, and first stick they're going to get me. A great piece of equipment.
I did hyperbaric treatments 2 days before my surgery. I had a congenital abnormality that I was born with, and I had plastic reconstructive surgery to fix it. The doctor said it increased my rate of healing by a significant amount.
Hyperbaric oxygen therapy is therapy where we place patients in a closed chamber and put them under high pressure oxygen. With plastic surgery, initially it started out primarily for women with breast reconstruction after breast cancer.
My plastic surgeon is a supporter of hyperbarics and was completely on board with me coming to do a few treatments before and a few treatments after surgery. And then with my little sister, how much we saw it helped her when she had jaw surgery and broke her wrist, we decided that it would be worthwhile to do treatments after my surgery.
In talking with the plastic surgeons and the reconstructive surgeons, they've noticed an improvement in the postoperative swelling. The tissue swelling goes down much faster. Many patients have a faster return of the nerve function in the tissues, especially for facial surgery, where they will have sensation in their face, their lips, their jaw, far faster with the hyperbaric oxygen than in a patient who's not had it.
When I first came in, I was nervous because everyone says how claustrophobic sometimes they can feel, but since they're glass chambers, they don't feel claustrophobic at all. You just feel like you're laying in the room. So that was a relief when I was actually in the chamber. It was really relaxing. I got to watch a movie and got to just lay there and not have to worry about anything. And sometimes I slept, which was actually really nice.
We are frequently doing 2 or 3 treatments prior to surgery because the surgery dates are well established. If somebody's having surgery on a Wednesday or Thursday, they'll come in on Monday or Tuesday for hyperbaric oxygen. And then we will usually start therapy as soon as they're able to come see us after their surgery. And it is usually 10 or 15 treatments for 60 minutes after surgery.
Everyone told me I was going to be not able to do anything for 6 weeks, not be able to lift anything, not be able to put anything on high shelves. I was able to do everything like that after about 2 weeks. It was a lot faster than was expected. It was a nice experience overall.
All right, that'll wrap up another edition of the Best Docs Network, which of course features some of the best doctors in the Dallas-Fort Worth area helping change people's lives. And for more information on any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com.
That's right, and if you have a question or comment for us, we would sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
There you go. So long, everyone. We will see you next week.